The black market doctors, they don't know how to do the FUE either, right? They just delegate that to unlicensed people. How does the black market figure into that FUT versus FUE decision making?
In my experience, most black market clinics solely do FUE, and most of the time they don't see the patient in person before the surgery is done through photographs or over the phone, and mostly done via non-medical personnel. So, and by the time the doctor sees the patient's already there and been either sold 3,000 grafts or 4,000 grafts, or sometimes now we're hearing unlimited number of grafts for a fixed price. But this is one of the things I say to people is that, when you go to places like that, it's like, can I have that transplant off the shelf? And when you come to somebody like us, we're not selling you a hair transplant. We're looking after your hair loss concerns. We're diagnosing your condition. We're recommending treatments, and we're looking after your health in the medium and long term, which is the way it should be. It's not a commodity. But yeah, they do end up operating on people regardless of their suitability, and that's why you're going to get people who get over harvested because they're trying to push the envelope when that person could have done with an FUT. But equally so, I've also seen patients who had a FUT strip procedure when perhaps it wasn't in their best interest. It's much less common, you see that. But it brings us back to the point that really it's about the correct technique for the correct patient at the right time in their lives, and whatever it is you do it correctly and do it ethically.